So for those of you who don't know me or those who are, perhaps watching the recording after this, my name is Kristin Dulaney. I'm a paralegal and a project manager for Indiana Disability Rights. And I'm also one of the project coordinators for the self-determination or the supported decision-making Indiana State Plan. And I want to thank you all so much for being here today. This project has gotten so much support from many individuals and organizations, and it's great to see you all here and be able to share some more information. So just so you know, the plan is that I'm going to talk for about 15 minutes about how decision-making works, what the Indiana SDM State Plan is, give you an overview of the plan's goals, and then we'll talk about how you can make a public comment. After that, we'll open it up for any questions you have, and you're welcome to make public comments today too. So I wanted to let you know that while I'm speaking, I probably won't see your questions, so feel free to drop them in the chat. Justin, who is one of our IDR attorneys, is on the call. If he knows the answer, he'll chat back to you. Otherwise, I'll be sure to circle back to those when I'm finished speaking. And as always, just a quick access note, we understand everybody's coming from kind of a different environment. So feel free to take care of your sensory needs if you want to have your camera off or on and off, whatever works for you, that's fine. If you want to get up and move around, that works. Basically, just take care of yourself. We're pretty casual, no need to ask permission. We're really grateful that you're in this space. Outside of that, I think we've all been over tech enough that I will skip that. But of course, if you have questions, feel free to let us know. So getting right into the content for today, I want to start off by talking about decision-making and just really start by explaining that decision-making does not happen in a vacuum. We all make decisions every day and receive various levels of support for it. So to illustrate this, I'm going to share a story from my personal life. So a couple of years ago, I needed to buy a new vehicle, and I had a lot of support throughout this process. It was a really big decision for me. It started with going to a website called Car Gurus. And what I really liked about this website was I was able to compare different makes and models, see their prices, look at the mileage. And my favorite part was that I could sort by location. So I was able to see which dealerships in the area had the types of vehicles that I was considering. After I had a good list of places to go, I talked to my dad. He's a really good negotiator, and I appreciate his advice. So I knew I wanted him to come with me. So he and I spent a whole day driving around from dealership to dealership in central Indiana. And after looking at several vehicles, haggling with the sales guy, and feeling hangry while I was waiting for the deal to close, I finally got to drive off in a new vehicle that met all of my needs for a reasonable price. This is a great example of supported decision-making. I was supported throughout the process by the online research, my dad's advice and negotiation skills, and the sales team. But at the end of the day, I got to be the one to choose. Sure, I could get advice from my dad and listen to the sales pitch, but I was allowed to disagree. I could walk away from the deal, maybe try a different lot, or just scrap the whole thing and keep my old ride. Even though people helped me, I got to be the one to make the final choice. Now, imagine if that was different. Imagine if my dad was my guardian and he got to make the decision. Imagine if he chose the car that I would be paying for. Imagine if he didn't even take me to the dealership. Further, imagine if that was true of all the decisions I made in my life, including where I bank, where I work, and even who I hang out with. Guardianship is a heavy tool and is the most extreme form of decision-making for other people. Decision-making is a vital part of the human experience, and there are lots of other ways that decision-making can be made. All of these types of decision-making supports exist on a spectrum, and everything less than guardianship is a less restrictive alternative, or LRA. This includes things like a power of attorney, a healthcare representative, supported decision-making, medication reminders, automatic banking, and a whole host of other supports that are out there. Now that we've talked about different kinds of decision-making tools, I'd like to introduce the Supported Decision-Making Indiana State Plan. What has brought us all here today is that in 2019, the Indiana legislature passed Senate Enrolled Act 380, which requires less restrictive alternatives to guardianship, including supported decision-making, be explored before guardianship is used. From there, the Administration for Community Living gave a grant to Indiana Disability Rights and the Indiana Institute on Disability and Community to create a plan to make the legislation a reality. The goal is to improve access to and use of supported decision-making and less restrictive alternatives for individuals with disabilities and older adults. So from there, disability and aging organizations from across the state of Indiana have been working for over a year and a half to develop this plan. And that includes many of you who are on this call. We've heard from stakeholder organizations and disability peer-led groups, as well as from cultural linguistic minorities. And based on everyone's contributions and feedback, the steering committee is ready to present a draft plan for public comments. Now, I'd like to give an overview of the state plan and its goals. So the purpose of the state plan is to make a plan for the state of Indiana, including action steps to increase the use of less restrictive alternatives, or LRAs, including supported decision-making, or SDM, as an alternative to guardianship. This means that lots of people from across Indiana, representing different groups, have all come together to decide on steps we can take to give people greater access to tools to support them in making decisions so they don't need to use guardianship. Those of us working on this plan believe that all people should be respected and have the right to live self-determined and self-directed lives. The draft plan has 3 goals that I will share with you now. When I share the goals, I will first say the full goal from the plan that will be submitted back to the funder, the Administration for Community Living, but they're wordy, so I'll follow up with an explanation as well. The first goal is to empower populations impacted by guardianship and support self-determination and self-direction with accessible, comprehensive, and factual information to make informed decisions. So really, what this means is that we're hoping to provide information to people who are at highest risk for guardianship. We want to let them know that there are other options to support their decision-making. The second goal from the plan is to build statewide capacity for increased use of less restrictive alternatives, improving the collective ability of systems to facilitate the practice of LRAs. So this really means that we want to help systems learn about and plan to use less restrictive alternatives to guardianship. And the last goal, goal 3, is to implement innovative policies and best practices to support, prioritize, and sustain the use of LRAs. So this means that we want to be thinking of new ways all the time to increase the use of less restrictive alternatives and ways to keep those programs going. So in summary, those 3 goals are to empower populations with information about their options, help systems learn about restrictive alternatives, and keep finding new ways to use less restrictive alternatives. The plan also has action steps beneath each of those goals, which explain how we plan to accomplish each of the 3 goals. So I'll talk about those action steps now. For goal 1, we plan to empower populations by creating, connecting, and sustaining. Specifically, we will make sure that we have good resources available about supported decision-making. We know that there should be different types of resources for different groups of people. We also want to provide targeted outreach and education to those who are most at risk for guardianship. And we know that this outreach should go beyond just materials and include things like presentations, videos, etc. And finally, goal 1, we want to continue to review those materials and those efforts to make sure that they work well over time. For goal 2, we plan to help systems learn about and use LRAs by helping them become part of the systems that serve people with disabilities, older adults, and people with mental health conditions. Also, make sure that everyone who needs to know about supported decision-making and LRAs has information about it. Also, helping professionals like lawyers and doctors learn about the new supported decision-making law. And finally, by sharing information and resources with the community. We all know that peers and families are a great source of information. So sharing resources can help you all help each other learn about supported decision making. And for goal 3, we plan to keep developing new ways to use LRAs by monitoring people who are using supported decision making so we can learn what's working well and how we can improve for the future. We also want to create and monitor best practices for the use of LRAs and help people learn about the positives of using LRAs while also helping people become aware of possible abuse against people who are at highest risk for guardianship. We want people to know how to prevent abuse. And, excuse me, finally, we would want to follow up with people who are using LRAs so we can ask them what's working well and what can get better. So those are the goals that this group has laid out to help the SDM movement here in Indiana. We've worked hard over the last 18 months, and we're proud that so many organizations and stakeholders have come together to work on this plan. And we want to hear your thoughts too, or keep hearing your thoughts for those of you who have been part of this. This is a plan, and a plan is the first step toward the actions that will help make the use of SDM and LRAs more common here in Indiana. I know that making your own decisions and directing your own life is important to all of you, just like it was for me when I was buying my vehicle. And so it's important to us. And that's why I'm so grateful to all of you for your help to make this plan the best it can be, so we can move forward with the goals of empowering people to know their options, helping systems learn about and use LRAs, and keep developing new ways to use LRAs. And this brings us to information on how you can share your thoughts on the plan. Your comments are very important. They help us know if the plan that we've put together is reflective of what will really work to make increased awareness and use of SDM and LRAs a reality here in Indiana. So we are getting ready to open up the public comments period. The public comments will officially be open from July 1 through July 31, but you all are already familiar with this plan. You've been involved in it, so you're welcome to make comments today after the presentation. For the public comment, official period, folks are able to comment in writing by contacting me. I will put my email in the chat here in a minute, but I'll also read it out for the recording. So that is KDulaney, which is KDulaney at indianadisabilityrights.org, or mailing to me at Indiana Disability Rights, ATTN, or attention, Kristin Dulaney, 4701 North Keystone Avenue, Suite 222, Indianapolis, Indiana, 46205. And if folks have an accommodation or a translation to be able to provide public comments, you're welcome to contact me too. And I'll share my phone number in case that's easier for folks as well. So that is 317-722-3476. So really, just to end, I want to say that we're committed to making this the best plan it can be. And we really appreciate your thoughtfulness in attending today, participating as stakeholders and steering committee members, and most of all, your comments to help us improve. So with that, I'd like to open it up for any questions you may have. And of course, if anybody would like to make a public comment, we're happy to do that now too. So to start off, did we have any questions come through the chat during that time? I'm not seeing any.
I think you're all in the clear, Kristin. This is Amber.
Thanks, Amber. So the floor is yours now. Anybody who would like to comment? It looks like Jared has raised his hand. Jared, go ahead.
So my question to you, Kristin, is you mentioned that there will be a public review or a review timeframe for this plan to see how it's working. How often will this review take place? Or is that framed out yet?
Sure, this is Kristin. That's a great question. And to my knowledge, we have not established benchmarks for when we would like to follow up with evaluating materials or seeing how folks who are using LRAs are doing. But I think that's certainly something that we should consider adding in. And I know Amber is on the steering committee, and it looks like, I thought I saw Carly jump on too, who's on the steering committee, and Sean. So if any of you would like to jump in, feel free.
Yeah, this is Amber. Jared, excellent question. Thank you for that, bringing that to our attention, one, and then two, asking that today. I think it's really important to note that we look at this plan not only as just like a plan that's locked in, but as a plan that's like a working document, or a plan that's constantly, right, progressing and changing and shifting as needed. And so the reality of it is we are always going to be seeking feedback on a continuous basis, right? At any point in time, anybody has concerns or questions or feedback for us about the plan or its implementation or anything related to the plan, such as materials or information, and you want to share those with us,
Sure.
We'd love to hear from you anytime. In terms of like a more formalized way of doing that, I would imagine at least once or twice a year we would want to probably circle back. I can't say that with absolute certainty at this point, but I think that would probably make the most sense for us to do that, to shift and change anything or update things in the plan as needed or necessary potentially.
Okay.
Does that help answer your question, Jared?
You did.
Okay, great.
Thank you.
No problem.
This is Ryan. I have a question related with the review. I know, is that going to be based on occurrences or people reporting, or what kind of information will you be making those decisions on?
Yeah, this is Kristin, and good question. I guess maybe we should clarify and get a little more specific about review of what. Are you referring to, like materials and how effective they are with outreach, or referring to checking in with folks who are using supported decision-making or LRAs to see how they're doing?
Based on people who are using LRAs or that type of thing, yeah.
Perfect, thanks for that clarification. And I will say I'm not sure. I don't know if there are systems in place at this time to dictate like how frequently we should be checking in with them and what we should be looking at. But if anybody on this call, we have a lot of very knowledgeable folks on this call today. So if anyone has info on that, please chime in. And if not, I'm happy to follow up with some information after this too.
Kristin, this is Amber again. I'm wondering if it might make sense for the steering committee and the stakeholder group to circle back and look at maybe adding in something around monitoring and evaluation of the plan, and just some benchmarks around that might be a nice addition, because I think that it's a really great point. I think I know myself, and probably folks in the community, whether they're part of the disability community or a service provider or a guardian or someone utilizing LRAs, whatever the case might be, would probably want to know what progress looks like in terms of this plan's implementation, and sort of all the materials and information that's being shared related to the plan, and what that looks like and how things have changed and shifted for the better. And also then how we are plan to address like any challenges or barriers that come up. So I'm wondering if that would be a nice extra piece we really need to build into and add to the plan. Great feedback, guys. Thank you so much.
Yeah, this is Kristin. I think it absolutely makes sense to look at formalizing some of those benchmarks. So I'm noting that for the public comments now, and know that the steering committee will certainly take that into consideration.
This is Jared again. I have another question. Do we have a current number of knowing how many people are currently under conservatorship in Indiana? and what those amounts are, because I think you could use that even as a form of a benchmark to show that, you know, supported decision making is working.
I can probably weigh in on that, Kristin.
Thank you.
We don't have exact numbers as of yet, simply because most courts don't, I guess, do a great job of you know, record keeping when it comes to, you know, tabulating those numbers. Like we couldn't just contact the county court and say, hey, how many active guardianships are there right now? I don't know that any of them would be able to accurately answer that. And then, you know, with the you know, growing aging population, there's probably going to be, you know, some continuing growth in the use of guardianships, regardless of the growth of, you know, the use of supported decision making and LRAs. Now, if we could somehow break those numbers down and you know, look at percentages of the total population, that would be great. But as far as using the numbers themselves from the courts, that would be challenging, unless we were looking at just one county individually.
Thank you for the clarification, Justin. And one additional question for you as well would be, would we be able to add in the pilot program that you were steering as part of that, as part of the legislation to show that it, you know, it is working or it is in place?
To make sure I'm understanding your question, you mean adding in something that would require that data tracking as part of that?
Well, not only the data tracking, but mentioning the pilot program that you took charge in over in Richmond to try and start. Is that something that is going to be fully implementable in other areas?
Well, there have been you know, pilot projects in other counties that have begun and that are ongoing in various respects. None quite exactly like the one that was going on in Wayne County. I think other members of the steering committee would probably be able to better answer how something like that might be able to be built into the plan. I haven't participated on all of these calls, so I'm admittedly a little ignorant on all of that. But yeah, I guess as far as what we did in Wayne County specifically, yeah, I think that's going to be something that we hope to see further growth with throughout the state. And something that we're definitely seeking to do.
Thank you.
Kristin, and I'll just jump in to add a little bit of information there. Even though the specific pilot program may not be replicated in other areas, really the goal of this plan is to take all of the momentum that we've gotten from developing it and all the organizations that have been involved to work together to try to use a multifaceted approach to getting information out there. So for example, IDR is a legal advocacy organization. And so it probably makes sense for us to talk to other lawyers and judges to try to, explain, here's this new law, here are these options, and here's how you can help your clients use some of these options. Whereas the ARC is involved with a lot of self-advocates and the self-advocates of Indiana. So they can do some of that community outreach and do peer-to-peer outreach so that they're aware of their options. Ideally, someone would take on getting into schools and talking to school counselors. And so that way, when folks have transition meetings, in case conference committees, it's coming up there as well. Because really what we've learned through this experience is there are so many different referral sources to guardianship. It's become kind of the default option for folks. So being able to find all of the ways that people are coming to guardianship and try to head all of those off at the pass, it's going to take everyone, really getting the word out there and doing that targeted outreach by, this great group of partners that have come together.
Thank you for the explanation, both Justin and Kristin. It has definitely helped, and that is one of the things that I, as a youth transition coordinator, can go into the schools, at least in our area, and start kind of breaking down that school to guardianship pipeline, if you will. So once you have those materials, I would be glad to hand them to anyone and everyone that will listen.
What area are you from, if you don't mind me asking?
We serve Vigo, Clay, Park, Putnam, Owen, Vermilion counties. So West Central.
That's great. And thanks for being on this call. Like I said, people get referred to guardianship from all different places, and we know schools are one of the most sort of restricted areas to get information from. So,
well, especially when the teacher comes across, or the teacher of record comes across and literally tells the parents, because I've heard it sitting in the meetings, your child's about to turn 18. If you don't want, if you want to protect them, you need to get guardianship.
Right, exactly. And the parent is used to trusting the school and believing what they say, and if folks just don't know there are other options, then, that's why we're all here today. So,
Thank you
for that offer. Yeah.
Hey, Kristin, this is Melanie. Can I be on the steering committee? Can I be on the steering committee with you all?
Perhaps. I'm not sure that that's my decision to make, but I'm happy to ask those who are leading the steering committee. And I appreciate the offer.
This
Mel
is
is
Amber,
actually
the
doing
member.
A lot of work on this at the federal level with the Center for Youth Voice and Youth Choice. Is that it, Mel?
Yeah.
You want to tell them about some of the stuff you're doing at the federal level?
Okay, sure. Thanks, guys. I remember what saved. And we actually started tonight. We're training I think it's 14 to 22-year-olds. And we're just going in, it's about 8 of us. And we're training, we call it the Youth Ambassador class. And then we're talking to people about guardianship. It's a 16-week class. It's actually started up tonight. We got a grant with a bunch of people out in Boston, and we have been working on this project ever since October of last year. So we have been putting it all together, and we've been meeting every Tuesday and every Thursday for the last year. And so Tuesday night, we actually had a meet and greet where we met with the client. We met with the students. They're from 3 states. They're from Georgia, California, and not Oregon, but it's another state, but there's 3 states of them. And they're all coming together to learn about support decision making. Yeah. So I think it's going to be really good. Like I said, it's a 16-week class, and I think it's going to be great. Yeah.
That sounds great. Thank you so much for all the work that you're doing with SAVE and at the federal level to advance these movements.
Mm-hmm.
This is Amber. I'm on the steering committee, and I know I'm just the one person on there, but I think you would make a great addition to our steering committee. So
Thank
I know
you.
I'd love to have you there.
Thank
So.
you so much.
If I could circle back to Justin for a quick question. In terms of what Jared asked about the number of folks right under guardianship in Indiana and us not being able to get a good handle on what that looks like, right, for lots of various reasons. Is there another state or states anywhere else in the country that has been able to successfully figure out how to put either legislation or policy in place that addresses the data collection of that, or that would help to address the data collection issues, you know, around that area? Any good states that to look to that are doing that well and are able to have a good count of knowing who is under guardianship in their state, I guess?
That's a good question that I don't presently have the answer to, but something that I definitely should research. And now that you brought it up, you know, I definitely plan to, because yeah, we'd love to be able to see that happen in Indiana. So sometimes it's tough not to focus on what the current shortcomings are.
Right.
But yeah, that's a piece that's definitely going to be necessary long term.
Yeah, I think if we're definitely looking at benchmarks, right, and improvements and how to measure that as a state in terms of the implementation and success of this plan, right? And we want to look at, you know, measuring at some point, you know, how many more folks are hopefully utilizing LRAs as opposed to turning to guardianship as the default. It would be nice for us to figure out how we can capture that data at some point.
Right.
I
Absolutely.
may be thinking too big or being too hopeful for us to figure that out here in our state, but that's why I asked if there were any other states that were doing that well or have figured it out.
Right. And that's an excellent question. And I just haven't gotten to that point in my research.
It's not like you don't have other things to do all day long, Justin.
Right.
I mean, I don't know why you wouldn't have gotten to it yet.
We really just want to see right to counsel and guardianship actions before, you know, first and foremost.
Mhm.
This is Kristin.
Ryan,
I think these
I had another
yes,
question.
go for it.
I was just curious with the qualifications for guardianship, just in general. How do we know people are qualified? In my office, we provide mental health services, and we've got 2 clients assigned to 1 guardian, apparently. They aren't aware of their mental health situation. So that puts a lot of strain on them as a guardian. So it makes me wonder how do you guys look at that, and how do you filter and make sure that people are qualified? Is that something that's considered?
This is Justin again, and I'll go ahead and try to answer that. Also, another excellent question. Unfortunately, our state guardianship code, it's one of the many, many giant holes that we're hoping to fix. So every county functions differently in the way they handle guardianship actions. And presently, under our state laws, there's no requirement for a criminal background check. There's really not much of a process for, you know, the court finding out much information about the proposed guardian other than what their relation is to the individual they're alleging is in need of a guardian. So are they mom, dad, brother, sister? Are they someone affiliated with a service provider? That's honestly really all that the courts typically hear on that front. As far as, you know, I mentioned, you know, the lack of a requirement for a criminal background check. There is a provision within the guardianship code that lays out who can't be guardians, and you would presume maybe people who've been convicted of theft or domestic violence or molestation or murder, basic horrific crimes like that. But the really sole disqualification for being a guardian under our state code right now is being a violent sexual offender. That's it. So if you're over 18 and not a convicted violent sexual offender, under our state laws, you can be a legal guardian.
Okay, wow, thank you for that.
Justin, I have a quick question sort of somewhat related to that, and this may also help Ryan a little bit as well. If a service provider or an entity of some kind or a friend, a family member, whoever it might be, right, community member, feels very strongly that an existing guardian of an individual is not adhering to or is not necessarily what most folks will consider to be appropriate as a guardian for various reasons, whatever that might be or look like, right? How is there a mechanism or a way that could be reported somewhere, or how does that work, or how do concerns get filtered to the right person, right, to help address that problem, to see if maybe someone does need to step in and not necessarily remove guardianship, because we know that how extremely cumbersome and difficult and challenging and sometimes just non-existent that option is, but changing or seeking a different guardian for that individual.
Yet another excellent question, Amber, that is not really laid out in our state code. That is something that we can assist with at Indiana Disability Rights, although I'm currently the only attorney who's working on those individual cases. There are some attorneys with Indiana Legal Services who get involved in cases like that, both in their individual office and then with what's called their LAVA project, the Legal Advocacy for Victimized Adults project. So there are some attorneys who can handle those sorts of circumstances. We would love to have like a state guardianship ombudsman program or something of the like, who could receive those complaints and possibly get involved informally in some way, and maybe be able to coordinate with the local legal community to help find attorneys for people who don't have them. But really, when it comes down to it right now, the only way that the code has laid out for someone to challenge a guardian's actions is to file something with the court and ask the judge to decide. Now, that's going to be challenging without the assistance of an attorney for most folks, disability or not, right? So it's not an adequate system. It's not even close to an adequate system. But there are, like I said, some attorneys who do handle those cases, but there are only a handful of us that I know of currently. And I guess one thing I'll note quickly, an individual under guardianship could try writing a letter to the court if they're not able to find legal assistance for something like that, just to make the court aware that things are going on. Service providers or loved ones could do something similar, file into the guardianship action to let the court know that things are going on that may be inappropriate. But there's no clear-cut good path for dealing with those situations right now in the state.
So this is Amber, it sounds like very little safeguards built into our public policy.
Almost none whatsoever. The minimal due process protections that are included in our state guardianship code get ignored by attorneys and judges all the time. All the time.
Which makes the use of LRAs, right, that much more important to head off someone from just getting sort of pushed into that path to guardianship, or so that they aren't in this situation, right? Which we know is challenging, but yeah, it makes this plan and its implementation just that much more important for sure, and just
Absolutely.
extremely necessary and needed in our state.
And for anyone currently on the call or who might be watching this who isn't aware, we do provide no cost options counseling to individuals and families. You know, let's say, you know, there's a young adult who has some support needs, and they and their family's not really sure whether they need guardianship or something else might be appropriate. You can refer them our way. Centers for Independent Living, I know, also are typically good resources for that. But if they need maybe some kind of higher level, you know, consultation with an attorney on something like that, that is something we do, and we can even provide preparation services for things like, you know, powers of attorney, supported decision-making agreements, and things of that sort. I'm always willing to talk to someone to help avoid those unnecessary guardianships being established in the first place, because they are so difficult and it's so unpredictable when it comes to trying to get those terminated, even when it's very clear that they either weren't necessary in the first place or are no longer necessary.
This is Kristin. Thank you all for that. I want to make sure that I recognize a couple things that have come up in the chat. So Jared mentioned kind of going back to the data tracking piece that we've all been talking about. He said, I wonder if you could talk with CMS or FSSA to get some more accurate data for those under guardianship, because I know FEEDS and Medicaid must track that information. So that's another good spot to see if we can get some data from for benchmarking. So I appreciate that, Jared. And then Carly had said this is a timely question. I think that was related to how you can report guardianship issues. So thank you both. So this is Kristin. I think we've been having some great conversations, and you all have brought up some really great points for the public comments today. We do have some more time available. If anybody has other questions or comments, you're welcome to make those. If not, or if you don't feel comfortable asking it right now, feel free to reach out to me. Let me go ahead right now and put my information in the chat. Okay, that's in there. Any other questions, comments? Anything about the plan at this point? Well, great. Well, I'll stay on for a few minutes in case something pops in your mind, but otherwise, I think we can wrap this up. I want to give a big thank you to Justin for helping us with all of the legal questions today. And of course, Amber, Carly, Sean, steering committee members helping with clarification. Melody, I'll follow up about getting you on the steering committee as well. And of course, thank all of you so much for attending. You know, really, this plan would not be possible without the investment and the engagement of all of you and the stakeholders who have really been so great over the last year and a half in contributing to developing this plan. So Thank you all very much. Since you all are part of the stakeholder group, you will get some communication on July 1 when the public comment period officially opens. We'll be providing some information that you can share out to your networks. So that way, if anybody you know would like to participate in the public comments, they can do that. But yeah, I think that's all for today. I appreciate everybody coming, and like I said, let me know if there are any other questions.
Thank you. Bye, guys.
Just wanted to say, job well done, Kristin, Justin. Excellent.
Thank you,
See you guys
Amber.
later.
Nice to
Thanks.
see you, and thanks for your
You
help.
too. Yeah, anytime. Bye-bye.
Bye.